He's going to require a minimum benefits package. He's going to specify what benefits the insurance company has to sell to you, even if they raise the price of insurance. You know, we already have problems with mandated benefits in states driving up the cost of insurance. Greg talks a lot about this. I can tell you some of the worst ones: hair transplants that John McCain talked about last night, weight loss clinics. Mental health parity adds 10 to 15% to the cost of an insurance policy when they put it in there. So we don't know what's going to be in that minimum benefits package. He hasn't really talked about what's going to be required, but something's going to be. So think about it this way. It's a little bit misleading when he says, you will be able to keep the insurance you have today, as he did last night in the debate. He said that. Well, that's true as long as your insurance includes all the mandates that he wants. If you have an insurance package that doesn't measure up to what he thinks insurance should be, then you have to change your insurance to what it is that he thinks your insurance should be, even if it costs more money than what you're paying today. He wants an 85% payout rule. What this means is that insurance companies would have to pay out at least 85% of their premiums in terms of paying benefits to people. Now, this sounds pretty good. You know, I have to say, every time I hear about some guy, insurance company executive with his $20 million salary, and he's having some party over there in, someplace, going to a spa. The folks at AIG went to a spa the day after the government bailed them out. I mean, I say, well, maybe we should be talking about these 85% payouts. The problem is, much of that administrative overhead that they want to squeeze out actually does good things, like prevent fraud or determine whether or not you're getting the right type of care. People always, one of the things on the left, they always talk to me, I'm in these debates all the time, and they always say, Medicare only has 3 to 5% administrative costs. If we just had the government run it, we'd get rid of all these administrative costs that these private insurance companies have. Well, first of all, I think that underestimates the actual cost of Medicare. But let's assume it's true. Medicare doesn't have any administrative costs because it's cheap to write a check. Someone submits a bill, they don't check whether it's real or not, they just write a check. The fraud rate in Medicare is absurd. There was just a GAO study in Florida showing 30% of the claims were fraudulent. There was one guy who was a high school dropout who took Medicare for $100 million. He's sending a bill, Medicare says, okay, we got a bill in front of us, we got to pay it. Medicare doesn't determine whether you're getting any quality of care. In fact, Medicare is the only place I know where if you get sicker, or if the doctor makes you sicker, he gets paid more. Because you go back to see him a second time. He treated you, you didn't get well, you went back to see him again, he gets paid twice. Medicare doesn't care. No administrative costs. Think of how much money they're saving. He would have prescription drug price controls. He would do this a couple of ways. He would allow reimportation of prescription drugs from Canada. I actually think that could be a good thing if it was done right. I mean, it's simply if people should buy something at a cheaper price, they should be able to do it. And then if the drug companies in this country don't like people going to Canada and take advantage of the price controls up there, they can stop selling the prescription drugs to Canada. Canada would not be able to keep its price controls, would have to raise them. Right now, the way it is the rest of the country free rides on our research and development. The thing about prescription drugs is that research and development is very costly, production is very cheap. It costs $100 million to bring a drug to market and a penny a pill to produce it. So once we've borne all the research and development costs here, they can sell it for almost anything in Canada and make money. But if people were bringing it back here, they wouldn't do that anymore. Force the Canadians to raise their price, they'd pay some of the research and development costs. The way Barack Obama wants to do it is he wants to forbid the drug companies from stopping selling the stuff to Canada. He just wants to import those price controls right back here. And then he also wants to let the government set the prices for prescription drugs under Medicare. Under the Medicare Part D program, actually impose price controls that way as well. And then finally, he borrows again from Mitt Romney and wants to set up something called the exchange. It's just like what they have in Massachusetts called the connector. This would be a government-run marketplace. He says we need a market to bring sellers and buyers together. Well, that's what I thought markets did. I don't know why the government has to set it up, but he's going to set it up. It's going to be a super regulatory body over insurance all across the country, determining what is good quality insurance and whether it has the right benefits and all of this. And one of the things it's going to offer is a government option like Medicare for all. See, he's not going to impose Medicare on everybody. Given that it's $70 trillion in debt, that would be a little tough to do right now. But what he's going to do is create a government-run system and say, that's one option. You can stay in the private system if you want, but we also have a government-run system that you can go into. What could be fairer than competition between the two? But of course, the government-run system is going to be taxpayer-supported. So it can always offer lower premiums and just let the taxpayers pick up the rest. It can always offer expanded benefits and just let the taxpayers pick up the cost. It won't be very fair competition for very long. Inevitably, people will leave the private system where they have to pay more, move into the government system where it's supported by the taxpayers, and the private system will collapse in the long run, and you end up with a government-run system, I believe, in the end. And then finally, he has a variety of subsidies. He wants to expand SEPP and Medicaid. He has not said how far he would support expand these programs. However, in the Senate, he voted to expand SEPP to families earning as much as 400% of poverty, or $83,000 a year for a family of four, receiving government-funded health care under his proposal. He has additional subsidies beyond that for people who still can't afford health insurance, even after those subsidies. The total cost of his plan is somewhere between $65 and $110 billion per year in new spending. Now, I haven't figured out where the government's going to get any extra money lately. The cost of the bailout they just did was $1.3 trillion total. If you looked at all the different bailouts, there's not $65 to $110 billion laying around, as far as I know. But that's the estimated cost. It probably is going to be higher than that because he presumes a number of savings from things like preventive care, health care IT, reduced administrative costs, none of which I think are going to be very realistic.